Dr. Chi. Hello, Dr. Chi.
Hi, Natalia. Good
Good
morning.
morning. How are you?
I am doing well, and you?
I'm well, thank you. So this morning we're
Great.
doing we're creating some awareness on cataract.
Yes.
All right. So first of all, tell me what is cataract?
Okay, so cataract is one of the disease conditions of the eye.
Mm,
Usually, there is the lens, we call it the crystalline lens. That
mm,
lens is transparent.
mm.
Okay, that is what is the major focusing part of the eye. The light passes through that transparent lens so that the images can be formed on the retina. Okay, so cataract is opacity of that clear lens. When that lens is no longer clear, so that means the person can't see. The person will be able to see it well because there's no light passing through. That's typically what cataract is all about. It's the
Right.
opacity of the crystalline lens in the eye. Usually, that's it. So we usually do surgery to remove it.
Okay. And what brings about cataract? What brings it on?
Cataract on its own, there are various causes of cataract. Sometimes we can say, okay, fine, age as we grow. You see, as we are growing, your body is undergoing some changes. The same thing, every part of the body. So the lens in the eye is no longer as transparent as it was when you were younger. So there may be possibility of you developing the cataract when at your later age, maybe like from 50, 55, or 60 years and upwards. And also exposure of the eye to UV. Too much exposure of the eyes to UV can also cause cataract. Cataract can also be caused when there is injury or trauma. You see, something hits the eye or something, or maybe you are fighting with someone and mistakenly someone throws a blow. Okay, so
Right.
it can make it can just a traumatic cataract can just make the lens to go opaque
Mm.
at that particular time. Sometimes some people too who have some disease conditions, like they are taking some medicine, like maybe steroids, for instance. Prolonged use of those medicine also can cause the same cataract. Or
Right.
maybe other cases, people who have some serious eye disease conditions. You see, that's why we always advise people make sure you walk to the eye clinic and get your eyes examined. You get an eye issue, some pain or some discomfort, you just walk into the pharmacy, they give you anything. Yeah, in some cases, that medicine could help clear the discomfort you're having at that particular time, but may pose a threat to you developing something else.
Mm.
So inappropriate use of medicine, can cause cataract too as well.
Okay.
Yeah.
Okay, that's very interesting. And what are some of the signs to know that this is where my eyes are headed?
Yes. The typical sign of cataract is blood vision. You can't see well.
Mm.
You can see where you're because you see, like I said, it is the crystalline lens that is clear. It's when light it's just a glass, like a glass. You see the glass is transparent, you can see from both sides. But now when there is cut, something is blocking that view, yeah, so you can sometimes it's something like the senile age related cataract is developed. You see,
Right.
it starts coming up small by small.
Mm.
And it's different from it is like I'm saying now that is you can't see the opacity of the lens. Some people when they look at your eye, like they see that there's some growth like that coming from the white eye entering the black eye.
Mm.
Some people just assume that that's cataract, that's cataract. No.
Okay.
Cataract is inside, it's inside the lens, okay?
So it's
When
not
it is very
seen.
well matured, come again,
So
it can be seen when it is fully matured. When
okay.
you look at the round black eye, you see there's an inner white one.
Mm-hmm.
There's another inner hole there, the pupil, that is supposed to be black.
Mm.
So if it's not black, it's white. So that is like a typical case of what a cataract looks like.
Right.
Yes.
Okay.
So basically, most times it doesn't really come with any pain or anything. Just that the fact is that you can't see properly, and you can't see properly here could be due to so many other conditions. But for the cataract, yeah, typically it's yes, the
Mm.
blur vision, the blur vision that you will have.
Right. And how do you make it better?
Okay, so cataract we do surgery. The very known treatment for now is surgical treatment. We just do surgery. We remove that opaque lens there, and then we'll put another clear, transparent one. Sometimes they use laser. Okay, so there is no like medicine you will drink, no known medicine. I know that, on the other side of our practice, the other side, they believe there is some medicine, some herbal concussion, but these, frankly, have not been proven to be effective.
Okay.
So professionally, cataract is true surgical purposes. You just have to do and remove that opaque one and put a clear, transparent lens in the eye.
Right.
Yeah.
And can it be prevented?
Unfortunately, I don't think so. You can prevent cataract because, just like I said, the age-related one is you can't remain young forever.
Right.
So as you're going, sometimes you see the cataract may be there, but it may not be so matured. Someone 80 years, if you bring maybe 10 people 80 years, you see maybe one or two of them have their cataract well matured. The other people will have theirs, but it's not so matured like that. So they can still manage to see small. And sometimes when they come to the clinic, we give them some glasses. Sometimes glasses can help improve it a little bit. Not necessarily for you to see clearly. Unfortunately, so this cataract has become a burden globally in the sense that it is like the most primary leading cause of blindness.
Oh, right.
You see, because people, if you don't, like in the rural areas, probably due to lack of some health centers, eye centers, awareness, and financial setbacks or something. So most of them are not exposed to this knowledge.
Right.
You get. So if some of them, they realize that they can't see, they just remain like that, and that is it. Meanwhile, these people that can't see because of that cataract can actually be operated on, and they can see.
Right.
You see,
Very interesting. So what would you recommend that the minute, sometimes people just, and these things, they happen overnight, really. Before you go to bed, you can see everything clearly. And the morning when you wake up, your vision is a bit blurred. What do you recommend people do when they start experiencing blurred vision?
The first thing I always advise them to do is make sure you walk into an eye. Even if once you have clocked the age of 40 years, know that you're on the other phase of life. You see, you have entered the other phase of life. Even no matter how active you are, how agile and whatever you are, you have entered the other stage of life. So you need to take your health conditions consider your health condition when you are above that age. So we advise, apart from going for your routine medical, but also do the routine eye. Because at that particular age, some disease conditions will start coming in. But if you're able to get the right advice from the right professional, you'll be able to know how you can manage it. And one other thing I also like is that when you come to the clinic, for instance, this cataract, you get cataract, I can detect cataract in a patient today. That person can live the next 40 years with that same cataract. But I'm telling you that cataract is not well developed.
Right.
It comes small. But when you do not come, and then maybe you just, and probably, you see, sometimes, like I said, there are some other disease conditions that can make the eye not to see clear. It's not necessarily only cataract. When you talk about cases of glaucoma or refractive error that you need glasses, and then the cataract also in play. One person can have as many as 4 different conditions happening at the same time in the eye. But if you're able to walk into the clinic and, we examine, and then we should be able to offer the best alternative or the best management for that particular condition that can help you see, later in life. You get that. Then number 2, you see sometimes like the weather now is, okay, now it's raining season, but the sun, when the sun is out well, So we always advise for them to wear their sunglasses.
Okay.
We shouldn't take that for granted, maybe it's for life or something. No, the sunglasses is very, very, if you're able to get the recommended sunglasses from a clinic, it is perfect. That is the very best option. But whereby you can't get from a clinic, you can just buy the roadside ones.
Okay.
There are so many disease conditions that one can help protect your eyes from. But once you are 40 years and above, just so that you have to put your health condition in, even if it's like once in a year, walking into the eye clinic, do all the tests, make that the eye is fine. You can serve it for the next 1 year, the other year too, you also come. So that way, you'll be able to know where your eye is heading, know which condition is trying to pop up, know the best approach and the best management to take to, either
Right.
delay or correct or whatever the situation is, rather than waiting for the curtain to shut down. Nah, then you now comment. That would be
Yes.
like towards the end stage. Yeah.
Okay. All right, Dr. Chi, thank you so much for this
Thank you,
education.
Natalia.
We will definitely, do better, take very good care
Yes,
of ourselves. And I like that you mentioned that, the minute you hit 40, then you're on the other side. You need to take your
yes,
health very seriously.
yes.
Thank you so much.
Thank you, Natalia. Thank you.
All right, so you had Dr. Chi. She is from my eye center. It's in East Legon, and they have another branch in Tema. And she was telling us everything about cataract. So I think this is a conversation we've had with a lot of doctors where we've been told that you know your body, right? You